As all of you know, I've had 4 hip surgeries in the past 3 years, but now I'm going to tell you a little about these surgeries. During surgeries in the past, physicians had to cut into the skin and tissue to go into the joint to find the source of the problem. This could cause problems for other parts of the hip. According to Houston Health Alert, hip arthroscopy was first tried in 1931. According to MedicineNet.com, the word arthroscopic refers to a surgical technique where a doctor inserts a tube-like instrument into the joint to inspect, diagnose, and repair tissues. The 3 phases of having a hip surgery include before, during, and post-surgery. Hip arthroscopic surgery is a great invention that revolutionized the medical world. How do you know you need surgery? There are several reasons that a person can need an orthopedic procedure performed. To find out if you need this surgery, many tests are run, such as x-rays and MRIs. The first reason is called snapping hip syndrome. According to Dr. J.W. Thomas Bird, founder and physician at Nashville, Tennessee's Sports Medicine and Orthopedic Center, snapping hip syndrome is one of the main problems that lead to a person having this procedure. It is caused when something is catching inside the hip joint. Another reason is to perform a psoas tendon release. The labrum of the hip is a cup of thick tissue that surrounds the hip socket. It helps support the hip joint. When a labral tear of the hip occurs, a piece of this tissue can become pinched in the joint, causing pain and also causing catching sensations. Patients may sustain an injury causing a piece of cartilage to break away from the surface of the bone. These patients may benefit from removal of that piece of cartilage. What happens during the procedure? Arthroscopic hip surgery is also known as a hip scope. It allows doctors to cut tiny slits to move inside the joint instead of the large cuts that were once necessary. It usually takes 2 to 4 small slits that are 1/4 to 1/2 inch long. These holes are used to fit the instruments inside the joint so that the procedure can be performed. The instruments include an arthroscope, which is a long, thin camera that allows the surgeon to view the inside of the joint. Also, a variety of shavers are used that allow the surgeon to cut away the frayed cartilage or labrum that causes pain. The shavers can also be used to shave away the bumps of bone that are responsible for the cartilage. What happens after the surgery? Post-surgery is when pain and trouble really begin. Many contraptions are given after surgery, such as an ice machine and a CPM machine. The CPM machine moves the hip continuous to different degrees. Injections are given every day to prevent blood clots, and also foot pumps are used to prevent clotting. According to Mark J. Philippoine, an orthopedic hip surgeon at the Stedman Hawkins Clinic in Vail, Colorado, physical therapy is the most vital part of the healing process. So after the surgery, a patient must be in physical therapy. The patient must be weight-bearing. The day after surgery, this must begin. Crutches or a cane are usually used for a few weeks until the patient is capable of putting all their weight back. A specially designed brace by Mark J. Philippoine is worn so that your hip can move to a certain degree. It is worn around the stomach and down to the knee. Rehabilitation of the hip is done with multiple exercises that work and stretch every part of the hip. A stationary bike is also used for at least the first 8 weeks. Then a person can work their way back into regular activities and running. Hip arthroscopic surgery is an invention that is truly changing many people's lives in a positive way through these 3 basic phases. Hip arthroscopic surgery is a way for many athletes and non-athletic people to have a chance to return to daily activities that may otherwise be impossible without the surgery being performed.